or discomfort. Now it's important that when you're analyzing the low back that you do a full examination, including inspection, palpation, range of motion, whether it's active and or passive, figure out what's going on and then tape appropriately. So please just don't do this at home because you're seeing me do it, but we're just going to demonstrate a taping. So this is 2 eye strips, and they're about 6 inches long, and we thought this would be appropriate size for the low back. And what we're going to do is, this is going to be a taping for muscle tension relief, so we won't go into the specifics, but we're going to use no more than 50% tension. And on the tape, the special TheraBand Kinesiology tape by Kramer, you're going to be able to see that the stretch, we want 50%, we want this larger oblong shape here to turn into a circle. So if we take a look at the back, we can see that right here is 0%, but we want to, on our patient here, get it to about 50%. That 50%, anything under, will allow for you to have a recoil effect to the tape. Recoil effect means that it lifts up. If I wanted to do something like joint stability or push or compress on a muscle belly or fascia, I'd be using a greater percentage of tension. But because I'm dealing with muscle and fascia, I want to use lesser tension. So I need anywhere between 25 and 50%. And this is great, and this is unique about the TheraBand Kinesiology. So when we start, we always want to have the ends trimmed. Okay, we can peel back on the tape. You can put the ends on neutral, and here we're going to start about the LS, or lumbosacral junction. And you apply down with no tension on that tail. You saw me use the peel back method. Another method is to actually creating tearings. Peeling back. This way none of my oily fingertips touch the tape. And again, the starting point will start lumbosacral junction on the opposite side now with no tension of the starting point. Not that there's rules to follow, but ideally you want to dissipate the tension in the tape, so the starting points and the ending points of the tape should have no tension on them. So we want to always create a tension through whatever area we're doing through a stretched position. So we're going to ask Jose here to bend forward, take his left arm, cross it in front of his body, and he's creating a stretch towards the left side of the tissue. I'm going to peel back on this tissue, on the tape, hold this tape down, and again, having this little shape here as my guideline and this guy up here, pull it until I get it to be a circular position. That represents about 50% of tension in the tape. Once I get there, the end will go down with no tension. This is heat sensitive acrylic, so we need to rub it in. Great, and he'll come back up. If the patient has an inability to do this flexion forward with the arm across the chest because of pain or discomfort, then don't do it. You just want to create the amount of fascial tension as best you can, reducing the amount of pain in the patient. Here's a nice example showing that there's these convolutions or buckling in the tape, and that's ideal. What it's doing is lifting on the skin. This can decrease the inflammation and swelling at that area. Again, this is ideal for someone with maybe chronic back fatigue, low back discomfort. Now, we want to obviously figure out what's causing that, but for the time being, we're just using this tape application. So we're going to bend forward again, Jose, with the arm towards the opposite side. We're going to pull back. I have not touched the tape at all with my fingers. I hold the end. I stretch till I get to 50%. So that looks perfect, turns into a circle. I go along the erector spinae muscle group, and the end has no tension. I just tap it on. Again, heat sensitive, probably also feels good to the patient. Create a little friction rub here. He comes back to neutral. Now you'll see that the tape on this side does not have as much convolutions. One of the reasons is I put a little bit less, more tension in this tape. So there's going to be less of a buckling effect. Another thing to think about is that the patient may have a lot more fascial restrictions on this side of the body as well. This tape can be worn for up to 6 days. After 6 days, you'd like to take it off because of hygiene, and also it does decrease the stretch as the day goes on.